Have a mass located at maybe 12. It is right breast. Next slide. Yes, like the mass. We may have a mass located at 11 o'clock. So when it is 11 o'clock, so if we are someone who are caring from any patient, if the patient came, you may say that I found the mass at 11 o'clock at light breast 11 o'clock. So now anyone who can come may know that, so when I'm facing the right breast, it means that if I have 11 o'clock, it means that I'm in the upper, outer quadrant. So it is more precise. And when we are examining the mass in the breast, we also need to say or to show the distance from the mass to the nipple. The distance between the mass and the nipple. Continue. Next slide. Next slide, please. It's the same. So we talk about breast lymphatic system. You know that if the lymph node are damaged somehow, we find that the lymphatic system has broken. You will find if you get a chance to be in the hospital where there is a breast cancer patient, you may find a breast patient who has developed what we call lymphedema. So you find that if she has a cancer in the left side, you find that the arm has swelling. That means that there is no more, the lymphatic system has broken, and then the circulation there is not doing well. So the main reason that you will find those swelling, it means that the lymphatic system has somehow broken. So it's better also we consider that, and we will see in the future what we can do. Next slide. So you may confuse some cancers and other side, but there are some changes which happen to everybody. In puberty, you will see that young girl will have the duct to grow, lobes will be there. We find the breasts are dense, and in the pregnancy, the breast will grow. It can be tender, and then sometimes you can even the milk is coming out while she's pregnant. So at lactating phase, of course, the lobes will develop, and the breast will full from breast milk, of course. But in the menopause, we will find that there is a decreasing of lobes, and the breast will be softer and less dense. So next slide. There are some concerns which are not cancer. It means that everything in the breast is not cancer. You may find other things which are not cancer, mainly breast pain. You may face a woman with breast pain, so it can be cyclical pain related to menses. You can find breast pain related to pregnancy, or what you call chest wall. There is some pain, there is some breastfeeding problem. I may say galactosine, I may say mastitis and abscess. There is some benign masses which are not cancer. I may say fibroadenoma and simple cyst. So we can't be in details because we are on a hurry. But also there is a nipple discharge. At nipple discharge, when someone is presenting unilateral breast nipple discharge, mainly if it is spontaneous and bloody discharge, it is a concerning sign. So you have to take care of that patient. And there is something like breast eczema, maybe you have seen it, but also you have some sign and symptom from cancer. Next slide. So not all masses are cancerous. Not all masses are cancerous. Exam can detect masses. Exam cannot tell if a mass is benign or cancerous. So you may do a good clinical breast examination, you find a mass, but the only clinical breast examination will not tell you that this is a cancer or not. But all breast masses should be referred to a health facility. Next, please. Next. So there are some breast cancer risk factors. I will not be in the details, but most of them there is gender. Being a female is a risk factor. Having more age is a risk factor. Genetic is a risk factor. Family history, and those things. Next. So there are many. I don't go in details, but I think you will be having the whole slide. The next slide. So there are signs of breast cancer. I think you are seeing that image, but you see, she has now bilateral